For those of you who are tuning in now, please stand by. We'll be going live at noon Central Time. So just hang in there, just another 3 minutes, and we will be underway with our program with Sioux Falls Downtown Rotary. You are connected through Facebook Live to the weekly meeting of the Sioux Falls Downtown Rotary Club. And we will, in just a couple minutes, be proceeding with our program, which is an interview with Dr. Jane Stavem, our new school superintendent here at the Sioux Falls Public School District. So please stand by. We'll be underway in 2 minutes. Please stand by for just a few more moments, and we will be underway with our weekly meeting of the Sioux Falls Downtown Rotary Club. And our program today, an interview with Dr. Jane Stavem, Superintendent of Schools here in Sioux Falls, South Dakota.
Fellow Rotarians and guests, my name is Jason Herbold, President of the Sioux Falls Downtown Rotary Club. And I want to thank you for joining us today as we visit with new Sioux Falls Superintendent, Dr. Jane Stavem. Today's program is another in our education series and is quite timely as schools approach the new year. Dr. Stavem takes on this new role at one of the most unique moments in a generation. And we want to thank her for her commitment to the education and safety of all those in the Sioux Falls School District. Next week, we will continue our education series and will be joined by none other than University of South Dakota President Sheila Gestring and South Dakota State University President Barry Dunn. We recognize that many members are eager to meet again in person. We are thoughtfully working through how it will be arranged to ensure that our members and guests can interact in a safe environment. We are close and watching the data daily. Before I turn it over to Rotarian Jack Marsh, who will moderate today's discussion, I'd like to start with Rotary's four-way test. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? I'd like to now turn it over to Dr. Jane Stavem and Rotarian Jack Marsh for today's program. Thank you.
Thank you so much, Jason, and welcome to all the Rotarians who are tuned in, as well as our other guests. This program is being carried on Facebook Live and then is being recorded and will be archived on the Sioux Falls Downtown Rotary Facebook page for later viewing. I'd like to add my welcome, Dr. Stavem, to welcome you to Sioux Falls, welcome you to Downtown Rotary. It's a privilege for us to have an opportunity to talk to you, as Jason said, in this unique time, perhaps the most challenging time to take on the role of school superintendent in 100 years. So you have an enormous job on your hands, responsible for nearly 25,000 students here in the Sioux Falls Public Schools, certainly responsible to their families as well, and to this entire community. In my judgment, the overall health and well-being of this community is directly tied to how well we operate as a school district, as a public school district. So welcome to Sioux Falls, and I think you will find that this is a welcoming and supportive community as you go on and lead our school district. In-person learning will return in the Sioux Falls School District next week, the end of next week. You've decided to divide the student body into two groups, an A group and a B group. And I guess you would call it 2 days of orientation, Dr. Stavem. Maybe you'd characterize it in some other way, but so a week from Thursday and then a week from Friday, half of the students will turn up, and you'll explain the new protocols in this era of the pandemic and COVID, and we really want to go deep today in discussing what the school district is doing to make sure that we not only return to the priority of education, but that we keep our students safe, their families safe, as well as the teachers and the staff of the Sioux Falls School District. But where I'd like to begin, and this may be an unfair question to somebody who's only been on the job for 6 or is it 7 weeks, but what is the current state of the children in this community, families in this community? You have not seen students in class for 5 months, and I assume you've lost touch with some. I'd like to know how many of these families and students you have lost touch with, but what do you feel is, what have we lost in terms of academic performance and academic achievement? And perhaps more important, what about youth at risk, food insecurity, dysfunction at home, abuse, neglect? What are the things that really have you concerned about the condition of our community, particularly our young people and their families?
Yeah. Well, thank you to everybody for having me today. And, when you characterize my role, it makes me teary because it is a huge responsibility. It always has been, and now more than ever, because of some of the things that you just mentioned with the fabric of our community depending on education and it taking such a drastic turn last spring. And so, part of it is we don't know the impact yet. We've gotten a little glimmer because we had students who came back for summer programs, and they were very glad to be back in our schools. I talked with teachers, I talked with our principals, people who were in those programs. And what was great about it is it kind of gave us a small trial run with some of the protocols that we're going to have in place for everybody, but it gave us a glimpse into the lives of our students and the things like food insecurity and just not having places to go, and other programs that have been more limited this summer that they would normally be even just at a swimming pool or in summer camps or day camps that we might hold. They haven't been able to do that. And I think the thing that was most disturbing to me was on the last day of summer programs, we had a middle school age child literally laying on the floor crying and very distraught because he was not going to be able to come back to school the next week. And that says a lot about what he has experienced in the meantime. We know that there has been an upturn in some of the calls that our police officers have taken over the summer. And then there's also kind of an absence of activity with some of the work that our social workers would normally be doing. and the welfare checks and things like that have kind of dropped off the radar because those who are mandatory reporters are not in that daily constant contact with our kids. So those are the things that keep us up at night. We know kids have been okay and their families are doing the best they can, but some of our kids are not okay, and they've been in some pretty dire circumstances for an extended play. We've always had some measure of a summer break, but there are programs and things that would happen. So we're concerned. We're going to do some assessing very early on to gauge that lost learning and be ready with some of those measures that go into effect then with interventions and academic urgency. Urgency is going to be something that our teachers and staff will hear me talking about, because we can't think that we're going to come back and just do things like we would normally do, because we've got to pick up the pace and we've got to have a sense of urgency about what kids have lost. And really that's K-12, and you mentioned higher ed is going to join you next week. We welcomed 160 new teachers this year, and over 60 of them are brand new teachers. Where would we be if we didn't have a graduating class of new teachers to come and fill those places this fall? And so there has to be an urgency around education, and we're already going to experience some long-term effects. The ripples of this, I think, are going to be felt for many years. I expect that graduation rates are going to take a nosedive at some point to one degree or another. I hope we can mitigate that this fall as we get going. But I'm afraid that we're going to also see some kids who drop off at 8th and 9th grade who may not have, and that we have to literally go and find them. It will be, where are they? Did they go to another district? Did they leave the state? Are they just home and not aware that school is starting? I mean, it seems unlikely that anybody would be unaware, but if you're not checking your email, you're not checking a school account, you don't have access, you may or may not know when that first day of school even is. So
Dr. Stavem, give us an idea of how many students fell off the radar once you abandoned in-person class.
Well, we don't know from last spring to right now. We'll know as we're doing registrations and looking at class lists. People are dissecting that. I don't have a hard and fast number. And then we take that official count at the end of September for our state numbers, and that will help us to quantify that. I would say, maybe 10 to 15% we may have, but that is just a guess right now, because until they reappear, we don't know if they've completely dropped off the radar.
But so you think that 10 to 15% of those who were enrolled in school last March, you didn't hear from for the balance of the school year? Is that fair?
Well, and we had no closeout of that school year like we typically would. And then right now, as we bring kids back in, our building level secretaries and people, registrars, are trying to determine if we've got somebody kind of present and accounted for. But if we've lost a cell phone number or an address over the summer, right now we have no way of knowing where they may have gone. So
you have laid out some options for families as as schools reopen. One is they can go to the in person, attend classes. The school district also has set up this, it's called the virtual academy. Is that correct?
Yes.
Okay. Then I suppose there's still the option of true homeschooling. There is the option of private and parochial schools in Sioux Falls. And we hope that nobody exercises the option of just checking out. But give us a sense for how many you think will be coming back into the classroom, how many are taking advantage of the virtual academy, and how many you think are going to switch to homeschooling or are going to enroll at Sioux Falls Christian or the O'Gorman system. What are the trends there?
Well, right now we know that we have right around 3,000 families who have chosen our virtual academy. And that may be for any number of reasons. It might be a medical need that a child has where they just don't feel like it's safe to be around large numbers. It may be just a choice in something that might have worked pretty well for a family and they want to continue that. They still want to stay enrolled so kids have access to activities and athletics. It might just be because people want to see if things get better or get worse and want to give it a semester of time. We don't get the enrollment numbers for our parochial partners, but when I spoke with them, many of them were seeing about the same numbers. I don't think any of us feel like we've seen a dramatic shift right now, but that could happen. And then homeschool numbers look about the same, but again, those aren't really quantified until later in September. So we'll give an update to the board. We'll have a better sense of what our overall enrollment does. And then we kind of look at where some of those trends are with open enrollment from other districts, students who enroll out to another district, and kind of all of those moving pieces. So right now, the biggest thing that we're paying attention to are the numbers of students in our virtual academy. That's very new. And so we'll be figuring that out. We have great people working on those teams. So they'll have a different kind of a first day of school. We're trying to make it an event like we do with kids who are coming in person, but we're glad that they've made that choice, and we hope that works really well for their family.
And is that available K through 12?
It is. Mm-hmm.
So has the deadline passed to sign up for the virtual academy?
We opened another narrow window. We had kind of our big push, and then we had just a few trailers. We got those all processed. So we've opened it up for just another narrow window. And even that comes with the remote possibility that they may not be able to start exactly with our first day of school, because there's a lot that happens on the backside of it with technology, with user accounts, and kind of all that online platform work.
All right, so has that window now closed, or is there still that option available?
It closes today or tomorrow. I would have to look. You can check the website, and that will give you the right information.
So if a family wants to make that change, what do they do? Do they call somebody? Do they have to fill out an application? What's the procedure that they should follow very quickly?
Go to the Sioux Falls School District homepage, and there is a COVID resource center, and it will list the virtual academy. They can click on that, and the form is right there.
And what is the web address?
That is sfsd.org. I believe you're asking me hard questions for a new
.org? All right. Okay. Yeah. I apologize. I know you're drinking from a fire hose here over the last several weeks. There's been a lot of debate, certainly nationally, about the science here. How do we keep people safe? How do we save lives? And we hear different things on a national level, certainly on a state level as well. The governor has taken a position that that differs with what we hear from Dr. Birx, Dr. Fauci, the World Health Organization, CDC. Talk for a moment about what is the science that is guiding you and your colleagues in the Sioux Falls School District? Who are the public health experts, the medical experts in Sioux Falls, in South Dakota, nationally, who you have come to respect and trust? Because you have an enormous responsibility here, and I assume that you're going to rely on the science to guide you. So who do you trust?
Well, everybody and nobody, all at the same time, it feels like, because so much changes along the way, and this is a pandemic that's a first for everybody in managing this. So our local public health officials, of course, are people that we work with directly as they are doing contact tracing and helping us with the protocols that happen with an exposure. Thankfully, we are in a great place with very, very strong medical services, and we have had doctors from all of those large entities in our community that have helped us kind of gauge what we're doing. Pediatricians, epidemiology, all of those people right in the medical field. And then it's taking that coupled with CDC, American Pediatrics, and all of those moving pieces that fluctuate just a little bit, and putting those together for a school context. Some of the guidance is very easy to overlay in the context of school, and some of it is not. And so all of those things that we know prevent spreading things around is what we pay closest attention to. And that's whether it's COVID or influenza or strep or MRSA or any of the things that, come into a school setting. And so it's face coverings, cloth face coverings. Some will have shields on if that's more conducive to their work environment or students who need to see facial clues for services, it's hand washing, hand sanitizer, cleaning protocols, and then availability of all of the equipment and the things that you need to be able to do that. So our teachers making sure that everybody's got spray bottles with the right formula in it so that it's effective, so that we are doing it at the timing that's recommended. So it's really taking all of those things and then laying that into a school setting. So then it's going the next step of spacing people, putting in some physical barriers that may block people transmitting germs from one to another, and doing that as much as possible. If you walk into our hallways this morning, I was over at Lincoln High welcoming all those new teachers, you'll see arrows in the hallway. So even if it's a larger number of students, it's directing them in traffic patterns that might be a little bit different while they're wearing masks. So
let's talk about what are the changes and modifications that you've made in the buildings. And I don't even know the number of school buildings there are in Sioux Falls, but
there's a lot.
30 or 40 or more. So what are the modifications that have been made, both in the facilities, in furnishings, in equipment, in erecting new barriers, changing out water fountains? I don't know all the things, but and are they universal? Are the standards now universal throughout the district, or is it a building by building standard?
Well, it's both. It's those universal standards, and then every facility is different. You know, in some places you have older schools where the hallways were narrower, and newer schools, those hallways are wider, or you may have a variety of traffic patterns as opposed to one hallway that has to serve both. So if you start at the ceiling and you work your way down, it's having air filters that are different in terms of being able to filter and cycle in fresh air. It's having furniture that might have occupied a room that might have gotten taken out to give more space if we're just talking about desks in a room. If you are in a school that already had done some things with alternative seating arrangements where you might have had places for kids to choose their seating, now you might have plexiglass barriers in the middle of a circle table that separate kids. There's dots on the floors so that little ones know where to sit to be spaced away from each other, or maybe when they're in the library. And then it's those traffic patterns. And so all of our building leaders are working with their staff to say, how do we take this space that's functioned in a way that's very familiar and do something unfamiliar? Lunch, how do we space kids apart? Where else can kids eat in a building? And how does that change a work pattern for our custodians? So there are so many moving parts to this, and the logistics are just off the charts, and people have done.
So how expensive was it to make all these modifications? And I know that there were both state and federal dollars available. I think Governor Nome announced $42 million was available for school districts throughout the state. How much of that came to the Sioux Falls School District, and how much of it is an expense that has to be borne strictly by the district itself?
Right. Right now, I believe our figure is right around 7 million. And I think one of the things is we're coding things if it's specifically COVID related with potentially some more money coming along the line. But one of the tricky things about this is we don't know what the duration of this is. So as you buy masks so that nobody goes without a mask, and you buy cleaning solution, and you buy equipment to make a divider, we don't know how long we're going to need those things. We don't know if it's 6 months, is it 2 years, or is it what time duration. So right now we feel like we're in good shape for having what we need. The other thing is supply chains. We've ordered a lot of new devices, so if we do have to go to remote learning, every student has a device, and we're able to kind of accommodate that with some other provisions to start the school if we have to go quickly, because some of those devices aren't going to get here for when we thought they would because of supply chain issues. So, it's not just our school district doing these kinds of practices, it's every school district in the nation to one degree or another. So there's some realities to getting what you need. We're in good shape right now.
So the CDC has recommended, universal masking. The CDC hasn't necessarily said it should be mandatory throughout the country, but the CDC says there is value regardless of your age, in wearing masks. And I know there's been a change in the policy that's being adopted by the Sioux Falls School District. It is now, I believe, referred to as an expectation. But does that mean it's an expectation that will be enforced? So, so what is the masking policy for students, teachers, and staff K through 12?
Well, these things, you pretty much see everybody with this, or a medical mask, the more medical looking ones, or I have this new thing that I ordered over the weekend where you put it around your neck and then it goes up and down. I thought that would be kind of fun to try. I'm not sure I'm a big fan, but there are so many things that have gotten attached to this mask thing, whether it's political or just the aspect of personal choice. And so we know that masks are one of many things that can help us protect the spread and keep people going where we want them to go and doing what we want them to do. And so I've said the eye on the prize is getting and keeping kids in school and staff in school. So when we say we expect masks, it means very much the same as another district who said required and another district who said mandated, because ultimately we have to make a choice as to if someone is not in a mask, what's the penalty? Well, I don't feel like it's right or legal to deny a child their access to education because of that mask factor, but we do have to have some steps in place. One is reminding, just like we do if a student forgets something else. Hey, really need you to get your mask on. Do you have one? If you don't, here, I can give you one. If you do, grab it out of your backpack and put it on. The other piece is students may leave the house in a mask, just like they do now in one state or another, and they get to school and lo and behold, that mask that mama or dad thought that they were going to have on is not on. So we also believe that when we value a partnership with parents, they need to play an active role in this too. And we might make a call that says, hey, your student came today, they didn't have a mask on, which the parent says, what? They said they were going to wear it and then they didn't. And so I will help reinforce that when they get home.
So is it proper to call it a mandate?
It's proper to call it an expectation. And we have steps in place, just like we do for other expected behaviors, for helping you comply with that. If we, treated it as discipline, do we want a child sitting, away from instruction all day? No, I don't want that. Do I want staff spending their whole day chasing down masks or no masks? No, I don't. But we do have to have steps in place, which we do. Ultimately,
so is it fair to think of it like a dress code?
No,
that
it's not like
not.
dress code. No, because I expect you to, well, it is in one way and not in another. I expect that you're going to show up to school wearing a shirt and pants and shoes. If that t-shirt is inappropriate and causes a substantial disruption, I might ask you to change it or to make another choice. Same thing if you show up with a mask, which I expected you to wear, and it has an inappropriate symbol that causes a substantial disruption, I'm going to offer you a different choice so that you can not create that disruption. But to think of it in terms of being clothed and being decent, which is what we expect people to do, it's a little different than that.
Why the hesitancy to make it a mandate?
Well, because you always go back to that enforceability piece. And I'm not okay with denying a child a free and appropriate public education. And I want to do everything I can to help them comply with an expectation. But we also have been in a community that values personal choice. So we're trying to walk that very, very delicate line down the middle of all of that, which is really difficult to do. Ultimately, I need everybody's help to get kids in school, to get staff in school, and to keep them there. And I believe that this community is going to help me do that. And so I expect to see masks when people come to school.
And is it mandated for teachers and staff?
Teachers and staff are also expected to have those on. And then there's variations of that. So nutrition services are required. If they're food handling, just like we would expect them to follow all of those food handler safety protocols, we want them to do that. When our custodians are cleaning, we want them to have all of that protection on as they're on that front line of really keeping our buildings clean. So
for staff and teachers, is that a mandate?
It's a requirement depending on your position in the district, and it's an expectation for others. Okay. And we delineated that for staff.
Talk about some other steps you're taking. What about daily health screenings? Whether you're a kindergartner or a high school student. When I present at the schoolhouse door, are you going to take my temperature? Are you going to ask me some questions, or none of the above?
We're asking parents to partner with us to do that checklist before a child ever comes to school, just like we do now if your child has a temperature, we ask you to keep them home. And so it's going purposefully through that checklist every day. But then we know some kids may get to school and they may present with symptoms at school, and we have our protocols in place too for how a child may be sent to the office. We have places that will be designated if a child is symptomatic that's away from other kids and staff. And there again, though, these protocols that we have are designed for places that assume a large degree of flexibility with a physical space. Schools are not always like that. So we may have had to have cleared a room out to account for that. We have crowded schools, which is why we're building new ones. And so it's taken a lot of logistical work to make these things happen.
So give us a sense of what's on that daily checklist that parents need to run through before they send their kindergartner or their middle school student or high school student off to school.
Yeah, and I would just couch this too with, we understand that our parents are trying to get to work and get to the places they need to as well, but it's going to be more important than ever to be diligent with this. It's a fever over, I believe, 100 point something. I'd have to look at the checklist. Okay. It's a cough, any presentation of, all of the COVID signs that we've seen, nausea, headache, any of those things, lack of taste. It's all on that checklist that we've sent out a few times, and it is available again in that COVID resource center. But those general illness things, which then you might need your physician to help you decide if it's something that needs to be tested or if it's another ailment. We have a lot of people testing negative in our community as well, but they're testing still positive for strep and for, other ailments that we have already had prior to COVID.
But the expectation is that they will be kept home,
right?
If any of those conditions apply.
Yes, and then
so let's say they still come to school. They didn't confide in their parents what was going on, or the parents weren't diligent. So they show up at school and they have a low grade fever, or they have a high fever for that matter.
Yeah.
Or they present with a cough or whatever. Then you put them in isolation and call the parents. Is that the plan?
We have a protocol that the school nurse will help with so that we get them to a location where we can both care for them as well as make that parent contact to have them taken as soon as possible and receive medical care.
Very good. Let's talk about how the school day, I don't know how it's going to function. I mean, I think about changing classes in the hallways, or when, in the elementary schools, when all the kids line up to, go to a special, or they're going to lunch or whatever. How do you handle social distancing in the hallways, in recess, during lunch periods? I know that you've set up these barriers and you have the masking expectation in classrooms, but a lot of the potentially close contact is actually outside of the classroom.
Right. So there again, that's where that mask expectation comes in. But some of it is also keeping kids in groups, and it might be that the adults travel this year where the kids used to travel. It's in transitioning where it might have been everybody, all the fourth grades line up and all of them go down the hall at the same time, and now you're doing staggered versions of that. Again, it's those directional things where you may have them going the same way so that they're not crossing paths. Recess is another thing that our principals and teachers have been working on so that they're kind of zones. So those groups of kids again stay, because part of this is just minimizing how many people you come in contact with in a day. Not that you're not in contact ever with anyone, but that it is smaller groups. And so there are things, band and chorus, where we used to have large groups of kids. Now those will be smaller groups so you can space them out. and it might be in the auditorium as opposed to in the band room or in the choir room. So it's really working with all of those spaces and places in a school. It's been a lot of adjustment of schedules and then the logistical work on top of that to keep people as far apart as well as we can.
And again, is this district-wide, or is it up to the principals, because you're dealing with different age groups and
Yeah.
different facilities, some older than others?
Yeah, it's both. We've given guidance, and principals kind of have an entire list to go through. Right now, they're submitting their plans for how they're going about making those plans so that we can kind of think through those things with them. Or if they run into a jam, they give us a call, and people here kind of work with them, go out to the buildings and look at the physical space with them. And they're also doing a lot of work with each other and what works and ideas that they have. We've had a number of Q&A sessions for our principals. They're running some scenarios this afternoon. I mean, a lot of this is practice. We haven't done this before.
Right.
So you actually have kids in school. You know, a lot of it is hypothetical until you're actually working, and then you say, oh, we got to change this up. Again, those summer programs were really helpful for that. And I think also once our teachers and principals could see it and see kids in action, they went, oh, okay, yeah, this works. I would walk into a classroom and see maybe 3 or 4 at a table with a teacher with the barriers or masks. 2 were over here, spaced 6 feet apart. A couple were over in another area, and it was working great. Now we have to do that with a little larger groups. And so we'll see how that goes. We're going to practice with our A-B schedules in case we would need to go to that. But you can hear with all those logistics, that's part of the reason why we made that choice for those first 2 days. Is it's
But right now, the A-B schedule is only for those first 2 days.
That's correct. Right.
But
Yep.
So let's talk about at what point do you make a pivot? You know, let's say you have a hot spot, you know, or you have even a positive case in a school.
Right.
What's gonna trigger either a school closing or some hybrid or going to an A-B schedule or maybe some other version? What is the data that you're going to track, and when will you know to throw the switch?
Yeah. Well, there isn't a magic formula to this. And so we haven't set hard and fast numerical thresholds. What we are doing right now is getting our mechanism in place for just how we watch a lot of things at once, just like you would on a spreadsheet. And so things that we already look at, even when there's like a flu outbreak, we're looking at staff absences and staff absence due to COVID, student absences, student absence due to COVID. And are there places in a school where we can see frequency ramping up? And then the reality that goes with that is I have to have staff in place to be able to function. And so if we get to a point where we're not able to do essential, kinds of functions, if all of our food service people are out and we can't find subs for them, we can't serve lunch, that's a big factor. And we're probably going to have to delay something or move to a different schedule. What we're trying to do that's different than last spring is last spring it was kind of an all or nothing proposal. It was everybody's going and then we closed everybody. Now we're trying to look at it school by school, might be grade level by grade level, classroom by classroom, to try to keep things going. You know, what I've said is it's kind of like flying the plane, and you might lose some parts, but if you can keep the plane in the air, we will, because once that plane hits the ground, it's a lot harder to take off again. We know our community is depending on us to have a lot of other things going, but yet we also have to be wise in how we do that. So some of it just really comes down to common sense, and can we keep operating, and do we have the adults needed to do our essential functions?
But do I hear you? Am I hearing you correctly that it may, going to a hybrid model or a closure that might be done on a building by building basis or with certain grades? It's not necessarily going to be a universal pivot. Is that accurate?
That's accurate. And we may even have a classroom that's remote for a couple of days and then comes back on site. So it's very granular compared to what we know is our first go around with this.
There's a tremendous amount of public interest in how this is going to go. And I think it's really out of concern, the safety of our children, of the staff, but also the overall health and safety of this community. Talk about what you think is the responsibility of the school district to keep not only parents informed, but keep the public informed about what's going on in the school district.
Yeah, you know, schools are hubs in our communities and in our neighborhoods. And hopefully people in our community have grown and will continue to feel connected to their school. And they know their building principal, they know their teachers, they trust them for information. And so, you know, a lot of this has come out in these big pushes from districts, and now it has to be operationalized at a building level, including that communication. So there are things that we will do to notify individuals if they are a close contact. There are things we'll do to notify a classroom, like we would do if there was kind of something else, chicken pox, an outbreak, or, you know, things that people should be aware of in a general sense. And then it's, you know, if it's an entire school issue, that will be a notification that would probably come out from that principal. So we're trying to look at it individually, small group, larger group, and then whole school, and then whole district as we look at those schools collectively. So we want to keep people informed, but we also want to be purposeful in how we're doing that informing, because we want people to be aware, but we don't want them to panic unnecessarily or be worried about things in ways that maybe they don't need to be as concerned about. So it's a real balance. We're going to try and do our very best to work with public health. They're trying to get geared up for how they do their work. But we also know that the volume is going to increase greatly. So we're trying to make sure with all of our local providers that they're going to be able to help us turn around that information in a timely manner so that we can notify people appropriately. And so that's still very much a work in progress. The small versions of that we've done so far have worked well, but there are also some cases where we feel like we haven't gotten the information as quickly as we need to. So we're going to try and do our very best to communicate well. Social media can be our very best friend and our very worst enemy sometimes in terms of factual information and correct information. So we're going to try and put things out as proactively as we can. But what looks to be true in one school may not be true for another school. So you can't take something that is put out in one place and then assume that that's true for all of our schools. So people need to just be aware of that.
So will the school district keep the public informed if there's an outbreak in a school, or if you need to move to a hybrid or close a school? How are you going to report this not only to parents, but report this to a very concerned community?
Right. Right now, we're envisioning doing this by school. We have not, and nor have I seen other, organizations put out like their daily COVID alerts and the numbers that they've sent out. We'll have some of that probably available on school websites. And what if we are closing a school, I think that will be widely communicated. But we have not said, we're going to give you a daily count of COVID cases in the school district, because I don't.
What would be the downside of that?
Well, the downside of that is if we know there's one at a school and it's a child who happens to be gone that day and it's a personally identifiable piece of information, we also have to be cautious about privacy. And that's a tough one because of how this whole thing is being managed, trying to keep people safe and informed while also trying to honor people in their privacy. It's a difficult line. We're still trying to get all of that figured out, but that's what we're going to try and balance between is what people need to have private and what we need to do for the better of the public.
Okay. If you need to switch to more, online learning, or you mentioned that you have computers, I assume laptops, on back order. How quickly can you switch to an all virtual learning district-wide and still ensure that there is some equity that regardless of a person's economic standing, that they are not only going to have access to a laptop, but that they're going to have access to the internet in Sioux Falls? Have you thought about that? I'm sure you've thought about that. So how are you going to handle it? And And how confident are you that the school district can continue to provide quality education, even if it can't do so in person?
Well, you said a few things in there, so I'm going to try and piece that apart just a little bit. Number one, we've been working with our community providers this summer to continue to widen out that accessibility for anybody who wants internet can get internet with some good, very low cost options that have stayed in place through the summer and into the fall. That's one level of it. And we'll continue to work with those providers. The second is we continue to have hotspots available so that we can give that
Not COVID hotspots.
No, two different hotspots. Internet hotspots in those devices that can provide internet for you.
Absolutely.
Location. And then we think that we have enough kind of, if we put all of our devices together, that we could do it quickly, for sure, 3rd through 12th. And then it was those K2 devices that we were waiting for to make sure that we have one-on-one. We think we've pulled enough devices, we can do that quickly. And then we'll know numbers when we get kids in school. When you say quality, I don't know that remote learning is ever at the same quality as being in our classrooms. There is great value to that. So can we keep learning for a few days in that remote environment? Yes. Do I want to do that long term? No, I do not, because I believe the essence of what we do is dependent upon that classroom environment. We're going to try and do a really good job as kids come back to school to say, what does your family have right now? Because we knew what they had back in March that might look different, and we have to do some quick work to see what people need. But that's an ongoing thing as people move. You know, I just know myself from moving from one location to another and having, you know, a cell phone that works and an address that I can use. That was still, you know, a cumbersome thing to get it hooked up and to get it running. And then it would work well in one part of my location and not as well in another. So I needed something to boost that. That's not an easy task, even if it's affordable or accessible. It's not just the flip of the switch. That means that we might have to have our liaisons help families, which they are very able and willing to do. And they'll get connected with those families right away to say, do you have what you need? And if you don't, how can we help you get there, and do that right away?
Dr. Stavem, would you address what's going on with athletics, particularly competitive athletics at the high school level, the performing arts, other extracurricular activities that would normally have some kind of audience, spectators? How are you proceeding with everything from athletics to improv groups to drama to choruses? How are you proceeding with that? And how much latitude does the district have, and how much are you're locked in because of the decisions of the South Dakota High School Activities Association?
Well, they have the phasing kind of protocol that's been laid out that we're aligning with. And so the phase that we're starting out in calls for limited participation by our fans. And I will just tell you, as the new superintendent in this district, I feel supremely put out by this, because I love our activities in athletics, and that's how you get to know people in the district. And so I have to remember that those things are first and foremost about our students and their ability to participate. You know, just like wanting kids to come back to school, we want students to have their experiences. And so to do that, it might look a little different. We know that we're going to limit crowds. We're going to give wristbands so that we know who can get in the gate and who can't. And then when they get there, we're also going to ask people to space themselves like we do in other public venues that have started to open up. But I know that we're going to have adults that want to be able to go and participate, and they're not going to be able to in the same ways. And I'm going to ask them to keep their eye on the prize, which is our student athletes and our activities. Small group performances, probably for theater and band and choir. Being able to be spaced out for marching band is a little easier than, spacing a choir of 100 kids, but they can still do small ensembles and be spaced. And we can do some video work where kids may be able to be spaced, and to see that concert, you might be watching it virtually this year or on a video. That's not ideal. And my biggest concern is for those kids who had a long career in their chosen area. They're hoping to pursue that at a collegiate level and beyond. I want to make sure that they can stay on that path and still hopefully get that college scholarship or be able to go to the school of their choice for that activity. You know, I chose where I went to college because I got into the choir, and those things mean a lot. So we want to help kids get where they want to go both this year and beyond.
Again, does the Sioux Falls School District have the latitude, the option of making a decision on its own regarding athletics or chorus or band or orchestra, or are you locked into whatever the decision is of the South Dakota High School Activities Association?
Well, we always have, choices, but I think we are aligning with those expectations because we're also trying to stay in alignment with area high schools, and with what we're asking our fans to do looks very similar to what another competing district is asking their fans to do. And communities all have different variables, and so some of that might look different here or in other places if we have to become more restrictive, or if we have something that happens within our student population that we have to pull out of an activity. But right now we're going to do our best to align and to try and stay, in step with our neighbors.
Very good. There's been a major push over the last few years to get more mentors in the schools, K through 12. In fact, this past year, there was a whole new mentoring program that came into town, and it's in its infancy, but hundreds of mentors coming into our schools, and certainly making a real difference there. What's mentoring going to look like in this COVID world?
Yeah, there's two sides to mentoring. I've been a mentor for 10 years, and it would have, again, pained me this year not to be able to go into a school and be with my mentee. But we're trying to offer some things, hopefully virtually. We're getting that worked out with our partners to see what we can make happen in that virtual environment. Some have restrictions on the organization side that does the mentoring, and some will be about our decision to hold volunteers out for at least this first semester to try and limit exposure that way. And so, what we want people to do is stay connected with those organizations where they said yes to being a mentor, because that'll come back online at some point in person. But our kids still need that connection with a significant adult. And you can never have too many mentors. And even if it's multiple organizations, that's bringing more and more caring adults to our kids. So we're going to try and get some things worked out virtually. We're going to hope to come back online with that at some point, but we need people to stay attached and say yes to those volunteer opportunities, whether it's in person or not, because we need you.
Talk about what this has meant particularly for the teachers in the district, but maybe I'm sure it extends also to the administrators and the counselors and the social workers. But how are your educators handling this enormous challenge? How are they handling the stress of it, the need to be nimble and adaptive? Are you worried? Are you worried about the educators that it is just almost overwhelming at times?
Oh, absolutely. I think one of the hardest things, I was just talking with one of our educators this morning, and I think one of the hardest things has been not seeing an end. When all of this has happened, and there has not been a break for everyone, certainly not mentally, but in the planning of all of this, all throughout the summer, there hasn't been any respite from dealing with this. That's very fatiguing. And just wondering how much longer are we going to have to deal with it. And then you just have the wide spectrum of perception and emotion that you do in any group of people, from somebody who maybe hasn't left their home very much at all, trying to do their part or to stay safe, to somebody else who may not think that this is significant at all, has no fear, makes those personal choices to go about their business as they normally have, and everything in between. And then the other, of course, complexity for a school district is we're working with a layer of children, the layer of adults, and then the layer that involves those two groups working together. And so while adults are dealing with their own level of anxiety and ability to cope with this, they're asked to help children who are doing the same thing. And so we know that this isn't something that we've ever dealt with before. We're going to try and give lots of grace, lots of hope, lots of encouragement, lots of safety protocols. But I also know that educators have a heart for children, and that while they have some anxiety and some apprehension about this, they love our students and they love children, and they want to step up and do their very best for them, even in the face of this massive difficulty that we're all figuring out how to navigate.
Any staffing shortages or concerns there? I mean, I'm curious about substitute teachers, for example. Do you have a shortage of substitute teachers coming back this year? Any other areas of real concern that you're not going to be able to staff up properly?
Yeah, well, we're working on a couple things. We still need some more staff for our virtual academy, and so we're working on that. We of course
and they need to be certified teachers.
They do, yes, certified teachers, and we'll get you plugged in and get you trained to work in that different environment. Substitutes, we've had a lot of our subs that have been willing to step up and sub again for us. We've had some that have signed up, but then when it comes to coming and doing the training, they have not come to that in the numbers that we might have expected, new people. That can always happen, but I think, you know, there's just some anxiety about what that would look like. And as I spoke to one of them, they're worried about doing things right. They know there's different things in place this year, and they don't know quite yet what that's going to look and feel like. But we always have a need for subs. This year, of course, you know, unlike any other year, but we still have maternity leaves that are happening. We still have medical things that are scheduled. So we have needs apart from just, you know, if somebody is out for a COVID related issue, that we have to have subs that come in and do a great job for us. So I would just encourage people to know, if you want to serve kids, we'll help you figure out the rest, and we'll do our very best to welcome you in, even with these other protocols.
You know, another group that I think is under enormous stress are parents, and maybe in some cases grandparents or other caregivers. What resources can and will the school district provide to parents for them to truly join the school district as being partners in the education of their children? You know, with if we have to go to a more hybrid model out of the classroom, as we, you know, as of course as we did here for the last several weeks of school. Now, you know, how can conscientious parents and grandparents step up and be supportive of their kids, encouraging of their kids, and also, you know, help the teachers, help the schools to work toward success?
Oh, I'm so glad you asked that. There's lots of layers to that too, but the first one is right now, as we're anticipating school and how they're talking with their children about it. You know, the TVs are on, the radios are on, and some of it is not exactly helpful if you're trying to prepare a child to go to school. So minimizing that anxiety. Remember, your teachers love and care for you. Remember, school is a fun place to go. Remember that they take care of you when you're at school, and it's going to be a great year. All of those kinds of pre-talk things. We're also doing some training that'll happen after the beginning of the year, and some things in the day-to-day work of our students that hopefully makes that technology component easier if we have to move to that virtual environment. So parents want to feel equipped. Just helping your child log on to your computer and knowing where to go and what to do. We're going to try to make sure that we give some really good, strong guidance for that, getting the year started. Then our counselors and the people in our schools are always great resources. They are not licensed mental health practitioners, but if the family is really struggling with some things, they are great connectors to the professionals in our community. Our health organizations have put out hotline numbers and resources. And sometimes it's just a matter of helping a parent talk some things through to say, yeah, you know what? That's completely normal, and I think you're doing all the right things, to that might be outside of the bounds of normal. Sounds like you're really frustrated. Here's some places that can be helpful. The other thing that I would just ask everybody to do, parents, grandparents, community members, you know, we're going to operate off our theme. Every year Sioux Falls has a theme. This year it's going to be together. Even if we're not physically able to be together in the same ways, we want to be together in our work. And notes of encouragement. I have 2 sitting on my desk right now that I've gotten recently. Sometimes we need to reread those anyway, but this year, those notes, and not just during the first week, but the second week, and as we continue to go, go through the year. Notes of encouragement, thanks, that constant good communication. If a child is struggling, you give that teacher a quick email or a call that says, hey, I just wanted you to know we had a rough start this morning. Just be aware there's some anxiety. Maybe a friend of ours is sick. They're fine, but my child is really worried because just the whole thing. And I think even in normal cold and flu seasons, there's, things that people worry about, kids worry about. Now, when somebody coughs, it means something different to all of us. It's kind of that looking at each other differently, and that's going to be true of all of us as we go through this year.
So let's look ahead to maybe, I don't know if it's a year from now, I don't know if it's 2 years from now, but let's say we have a vaccine in place and this, COVID is under control and we can return to some form of normalcy here. Mm-hmm. What do you think will be the positive lessons from facing this challenge? What are the enduring changes that we will make in education as a result of what we've learned in dealing with this crisis?
Well, that's a great question. You think you were, like a reporter at some point in your career. I think we have learned the value of relationships and the harm of isolation, and that we are not designed to be in isolation for long periods of time. And yet, I think we've also taken a quantum leap in education to be far more flexible and have widened our thinking. Just the other day, we were talking about what we call homebound services. Is if a child has to be home for a period of time, maybe they've had surgery or a medical need, typically we would send providers to that home to provide services. Well, now part of our layer of that thinking needs to say, can we do that virtually? Is that better for the family? Is that better even for the teacher? So it's widened our thinking about different ways of doing things. That being said, you also have to have quality materials, whether it's digital and available online, as well as in the classroom with a book in your hand or physical work that's going to be done. And so our ability to discern what's high quality and what's not will continue to always be at play, but we've had to get better at that digital aspect of that. Finally, education in this country is a gift, and it is a gift that we have all benefited from, whether it's public school, parochial, homeschooling. Education has to continue for our children, and it's up to us to make sure that they are present and accounted for in one of those areas so that we don't drop anybody, because that is a life-changing trajectory that we set them on. And so we have to be very diligent this fall about making sure every student and every family is connected so that they receive that education that they need.
Dr. Jane Stavem, we thank you so much for being responsive to my questions, and we want to, again, on behalf of the entire community, welcome you to Sioux Falls and to the school district. And we all share an appreciation for the enormous challenges that you and your colleagues face, and I hope and trust that this community is going to rally behind our children. So thank you very much. This meeting has been recorded and will be available in an archived form on the Rotary, Sioux Falls Downtown Rotary Facebook page. So with that, this meeting of the Sioux Falls Downtown Rotary Club stands adjourned. Thank you all for joining us.
Thank you, everybody.
Thank you.